Health is not simply the absence of disease, it's a complex tapestry woven from biological, psychological, and social threads. Multicultural psychology recognizes this intricate interplay, highlighting how culture shapes our understanding of health, illness, and healthcare. This field goes beyond traditional medical models, acknowledging that health disparities, the unequal distribution of health outcomes across different populations, are deeply rooted in social injustices. It compels us to confront the stark reality that a person's zip code can be more predictive of their health than their genetic code. Let's delve into the world of multicultural psychology and explore its crucial role in understanding and addressing health disparities. We'll uncover the historical roots of these inequalities, examine the impact of poverty and bias, and shed light on the unique challenges faced by marginalized communities. By understanding these disparities, we can begin to dismantle the barriers to health equity and create a world where everyone has a fair chance at a healthy life. Health disparities refer to the differences in health outcomes and access to healthcare that exist among specific population groups. These disparities are often preventable and unjust, reflecting social and economic disadvantages rather than biological differences. Multicultural psychology broadens the definition of health beyond the physical realm. It encompasses mental well-being, access to quality care, and the social determinants of health, the conditions in which people are born, grow, live, work, and age. For example, consider the stark reality of diabetes in the United States. While this chronic illness affects people of all backgrounds, certain racial and ethnic minorities bear a disproportionate burden. Native Americans, African Americans, and Hispanic Americans are more likely to develop diabetes compared to their white counterparts. This disparity is not due to inherent biological factors but is strongly linked to systemic issues like poverty, limited access to healthy food options, and inadequate health care. The roots of health disparities run deep, entangled with a long history of social injustices. Systemic racism, discrimination, and marginalization have created profound and enduring barriers to health equity for many communities. Generations of unequal access to education, employment, housing, and healthcare have led to a legacy of disadvantage that continues to impact health outcomes today. Take, for instance, the Tuskegee syphilis study, a horrific example of medical racism that left a lasting scar on the African American community's trust in healthcare. In this unethical study, spanning from 1932 to 1972, black men with syphilis were denied treatment, even after penicillin became available, to study the disease's natural progression. This egregious violation of medical ethics has fueled mistrust in the healthcare system among many African Americans, contributing to lower participation in research studies and preventative care. Multicultural psychology, through the biopsychosocial model, offers a powerful framework for understanding the complex interplay of factors contributing to health disparities. This model recognizes that health is not solely determined by biological factors, but is profoundly influenced by psychological and social factors as well. It emphasizes the interconnectedness of these domains, highlighting how chronic stress, discrimination, and lack of access to resources can negatively impact both mental and physical well-being. Consider the impact of chronic stress on individuals living in poverty. The constant worry about finances, housing, and food security can trigger a cascade of physiological responses leading to elevated stress hormones, increased inflammation, and a higher risk of chronic diseases like heart disease and diabetes. Multicultural psychology recognizes that these social determinants of health are not isolated factors but are intertwined with cultural and historical contexts, shaping health outcomes in profound ways. Poverty's grip. Poverty acts as a potent social determinant of health, casting a long shadow over the well-being of individuals and communities. The association between lower socioeconomic status and poorer health outcomes is well established, reflecting the profound impact of limited resources, chronic stress, and environmental hazards. Individuals living in poverty often face a perfect storm of challenges: inadequate housing, food insecurity, and limited access to quality education, healthcare, and employment opportunities, all of which contribute to a higher risk of chronic diseases and premature mortality. Moreover, poverty does not exist in isolation. It intersects with other forms of disadvantage such as race and ethnicity, amplifying the effects on health. For instance, communities of color are disproportionately affected by poverty, reflecting historical and ongoing systemic racism. This intersection of poverty and race creates a double burden of disadvantage, leading to even greater health disparities. Implicit bias. Implicit bias, the unconscious attitudes or stereotypes that influence our understanding, actions, and decisions, permeates all aspects of society, including healthcare. These biases, often operating outside of our awareness, can have a profound impact on patient-provider interactions, treatment decisions, and ultimately, health outcomes. For marginalized communities, implicit bias can manifest in subtle yet harmful ways, leading to microaggressions, misdiagnosis, and inadequate care. Imagine a scenario where a Black patient presents to the emergency room with severe abdominal pain. Due to implicit bias, healthcare providers might underestimate their pain levels or attribute their symptoms to less serious conditions, leading to delays in diagnosis and treatment. These biases, even when unintentional, can have life-altering consequences. Culture's influence. Culture shapes our understanding of health and illness, influencing how we perceive symptoms, seek care, and adhere to treatment plans. Multicultural psychology recognizes that healthcare providers must be culturally sensitive and competent, respecting and incorporating patients' cultural beliefs and practices into their care. Ignoring these cultural influences can lead to misunderstandings, misdiagnosis, and mistrust, ultimately hindering effective healthcare delivery. For example, certain cultural groups may rely on traditional healing practices or have different communication styles that impact healthcare interactions. Some cultures may emphasize family involvement in healthcare decision-making, while others prioritize individual autonomy. Understanding and respecting these cultural nuances is crucial for building trust, fostering open communication, and providing patient-centered care. Intersectionality. Intersectionality recognizes that individuals hold multiple social identities, race, gender, sexual orientation, socioeconomic status, and these identities intersect and interact to shape their life experiences, including health. This framework highlights that health disparities are not solely due to one social identity, but result from the complex interplay of multiple forms of oppression and privilege. Consider the alarming rates of maternal mortality among Black women in the United States. Black women are 3 to 4 times more likely to die from pregnancy-related complications compared to white women, regardless of their education or income levels. This disparity reflects the intersection of race and gender, highlighting how systemic racism and implicit bias within the healthcare system contribute to unequal access to quality maternal care. Bridging the gap. Creating a more just and equitable healthcare system requires a multi-pronged approach, addressing both individual-level biases and systemic barriers. Healthcare providers must receive training on cultural humility, recognizing their own biases, and learning to provide culturally sensitive care. Institutions need to implement policies that promote diversity, equity, and inclusion, ensuring that all individuals have equal access to quality care. Moreover, addressing the social determinants of health is paramount. This requires investing in communities, improving access to quality education, affordable housing, healthy food options, and safe neighborhoods. By tackling these root causes of health disparities, we can create a society where everyone has a fair and just opportunity to achieve optimal health and well-being. The journey towards health equity demands a collective effort, requiring collaboration among healthcare providers, policymakers, community leaders, and individuals from all walks of life. By acknowledging and addressing the systemic factors that perpetuate health disparities, we can create a future where everyone, regardless of their background, has an equal chance at a healthy life. In our pursuit of health equity, one crucial element stands out: cultural competence in healthcare. Cultural competence refers to the ability of healthcare providers to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. It is a cornerstone in reducing health disparities and improving patient outcomes. Imagine a scenario where a patient from a minority background visits a healthcare provider. The provider, who has received training in cultural competence, is aware of the patient's cultural background, language preferences, and potential health beliefs. This awareness allows the provider to communicate more effectively, build trust, and provide care that is respectful and responsive to the patient's needs. Real-world examples highlight the impact of cultural competence on healthcare outcomes. For instance, in a community clinic serving a diverse population, implementing cultural competence training led to a significant increase in patient satisfaction and adherence to treatment plans. Patients felt more understood and respected, which in turn improved their overall health outcomes. Another case study involves a hospital that introduced a cultural competence program for its staff. The program included language interpretation services, cultural sensitivity workshops, and partnerships with community organizations. As a result, the hospital saw a reduction in readmission rates and an improvement in patient engagement and health literacy. These examples underscore the importance of cultural competence in bridging the gap between healthcare providers and patients from diverse backgrounds. By fostering an environment of understanding and respect, healthcare providers can break down barriers and ensure that all patients receive the quality care they deserve. The journey towards health equity is ongoing, but with cultural competence as a guiding principle, we are one step closer to creating a healthcare system that serves everyone with dignity and respect. Together, we can build a future where health disparities are a thing of the past, and every individual has the opportunity to achieve their best possible health. As we look to the future, the field of multicultural psychology and health continues to evolve, driven by emerging research, innovative interventions, and a growing recognition of the need for policy changes to achieve health equity. Emerging research in multicultural psychology is shedding light on the intricate ways in which cultural factors influence health behaviors and outcomes. For example, studies are exploring the impact of acculturation on mental health, the role of cultural identity in coping mechanisms, and the effects of discrimination on physical health. These insights are crucial for developing tailored interventions that address the unique needs of diverse populations. One promising area of research is the development of culturally adapted interventions. These interventions are designed to be culturally relevant and sensitive, ensuring that they resonate with the target population. For instance, community-based programs that incorporate traditional healing practices alongside conventional medical treatments have shown great promise in improving health outcomes among indigenous populations. Another exciting development is the use of technology to bridge cultural gaps in healthcare. Telehealth services, mobile health apps, and online support groups are making healthcare more accessible and personalized for diverse communities. These digital tools can provide culturally appropriate health information, facilitate communication with healthcare providers, and offer support in multiple languages. However, achieving health equity requires more than just innovative research and interventions. Policy changes at the local, national, and global levels are essential to create an environment where everyone has the opportunity to achieve optimal health. Policies that promote access to quality healthcare, address social determinants of health, and support cultural competence training for healthcare providers are critical steps towards reducing health disparities. Advocacy and community engagement also play a vital role in driving policy changes. Grassroots organizations, patient advocacy groups, and community leaders are raising awareness about health disparities and pushing for policies that prioritize health equity. Their voices are essential in shaping a healthcare system that is inclusive and equitable for all. In conclusion, the future of multicultural psychology and health is filled with potential. Through ongoing research, innovative interventions, and meaningful policy changes, we can move closer to a world where health equity is not just an aspiration, but a reality. By embracing cultural diversity and working together, we can build a healthier, more equitable future for everyone.